video's topic is metaphysis. Let's study introduction, definition, blood supply, clinical significance, and changes after epiphyseal fusion. Metaphysis is most actively growing part of a long bone, important for longitudinal growth, highly cellular bone tissue. The end of diaphysis toward epiphyseal cartilage is called metaphysis. Present in long bones, lies between diaphysis and epiphysis. Blood supplied by nutrient arteries, periosteal arteries, juxta-epiphyseal arteries, which are end arteries and form hairpin-like veins. Hairpin veins cause sluggish blood flow. Bacteria and emboli easily trapped, leading to infarction. So in children, metaphysis is commonest site of osteomyelitis. But in adults, after epiphyseal fusion, anastomosis occurs between metaphyseal and epiphyseal arteries, and end arteries disappear. Blood flow improves. Osteomyelitis is rare in adults.